And now I'm talking to Lara Kelly, the Communications and Campaign Officer for Mental Health Reform. Lara, how's it going?
Hi Darren, good, thanks, how are you?
I'm fine, thanks. Lara, could you tell us first about mental health reform? I interviewed Shari McDade, your the director there, nearly 2 years ago, but it's gone back a while now. Could you just tell us, remind our listeners please of who these are?
Yeah, absolutely. So Mental Health Reform is the National Coalition on Mental Health. So what we're trying to do really is to promote improved mental health services and social inclusion as well for people experiencing mental health difficulties. So I guess when you spoke to us a couple of years ago, we've increased in numbers since then. So we've got 52 member organisations now. So from across mental health groups, the voluntary sector and the professional associations working on mental health as well.
Yeah. And you kind of like lobby the government, don't you, and the Department of Health and all. That's what have campaigns and all. That's what you do, isn't it?
Yeah, we do a lot of advocacy work. So it's mainly, I suppose, trying to make sure that the voice of mental health is heard and that mental health stays on the agenda. And I suppose really what we're aiming to do is to be a united voice for the mental health sector. There's quite a lot of different groups working on the issue, but we try and bring people together and make sure that there's one clear message coming to the government.
Yeah, we're here to talk today about your budget campaign. The budget's coming up in October this year. Like, I know when the current government got elected in 2011, in the programme for government, they had set aside 35 million extra a year for mental health funding. This is several years after a Vision for Change, that national plan came in. Could you just tell us what's happened in the last 4 years as regards that?
Yeah, you're right. That was the commitment in the programme for government in 2011, and since then, in the budget each year, we've seen allocations of between 20 million and 35 million a year for community mental health. I suppose our concern about this is whether that commitment in the budget is actually being delivered on. So a lot of that funding was for staff, and we know that recruitment has been quite slow. Like, say, if we look at the budget allocations over the last 3 years, that has led to the recruitment of 800 new staff members, but we're still far behind what a Vision for Change mentioned, the mental health policy from 2006, so we've still got a long way to go.
Yeah, and I think it was last year, the year before, the government, they said they gave 35 million a year, but they gave, are you saying like they haven't given the full amount every year?
So we had an allocation in 2012 and 2013. They committed to giving 35 million, and then in 2014 they committed to giving 20 million, so it had dropped down. We're asking for at least an additional 35 million this year, and I suppose the question about whether or not it's been delivered, it's tricky because so much of that funding was actually tied up in staff costs, and we know that recruitment has been slow and actually that some staff haven't been hired until the end of the year. So we've heard the phrase time-related savings. So, you know, if you don't hire somebody until the end of the year, that funding isn't being spent until the end of the year. So that's a concern because we know already that the staff that we have it's about 22% less than what's recommended in the Vision for Change, and even for children's services it's more serious. It's about half of what's recommended.
So if the government were to follow their programme for government, they would be giving 35 million in the upcoming budget, and they owe like 10 or 15 million from last year. Is that right? The commitment for last year was 15 million short of what was in the programme for government. That's right. So I suppose what we're looking for is the commitment and the follow through. You know, and what we're really saying to the government at the moment is that for the current government, it's going to be their last budget before an election. So if they really do want to make an impact and leave a legacy in terms of mental health, then they do need to commit at least 35 million in the budget and follow through on it. And would this 35 million, if the government agreed to it in the upcoming budget, would that fill the gap of the 22%, or we still have a long way to go, or what?
We still have a way to go. I mean, because if you look at, you know, the allocations over the last few years has led to 800 new staff. In kind of rough figures, we've got about 9,000 staff in the mental health services, and we need about 12,000. So we've still got quite a way to go. And I suppose even it's important to say that during the recession, mental health was particularly badly impacted, and about 1,000 mental health nurses were lost to the services during the kind of early years of the recession due to retirements and you know, staff not being replaced. So we've a long way to go, and I suppose the impact of that staff shortage really is that services are overstretched. You know, there are increased waiting lists, and I suppose people not getting the support they need when they need it.
Yeah, so in the early years of the recession, 1,000 people kind of weren't replaced, or they were lost in the mental health service. And then in the last 3 or 4 years, 800 have been regained. So, like, do you know the figures of how many, like, nurses we need and doctors we need? Like?
Well, what we've been saying is that staff now is about 9,000, and a Vision for Change said we needed about 12,000. So you can see there's a gap there of 3,000 staff. What has changed in the last few years is that you're seeing more multidisciplinary staff. So that's really important. It means that people are getting more access to, occupational therapists, social workers, psychologists, as well as doctors and nurses. So that's positive, but it still needs to go a lot further to meet the gap and to really live up to a Vision for Change.
And I know for the last 2 or 3 years there was a huge problem with recruiting consultants across from all different health sectors. Was that true? Is that still the case for mental health as well?
I think it's across the board that there is that difficulty. Like Minister Lynch has come out and said that there is a real difficulty in mental health, also for clinical psychology staff. So I think, we don't have a fixed policy on that in mental health reform as a coalition, but we have said that this is something the government needs to address, whether it's, in terms of the packages that they're offering people, or, anecdotally we would hear that one of the things that maybe would put people off working in the service is that they know it's overstretched. So I suppose it's a bit of a chicken and egg situation, that people need to know that as in prospective staff members need to know that the mental health services are well staffed. That if you do join mental health services, you'll have supervision from within your own discipline. So if you're a social worker, you'll have a senior social worker to go to for advice and that kind of thing. So it's really important, I suppose, that it's made an attractive place to work.
And the pay of mental health nurses starting now has been cut a huge amount in the last few years. But is it true that they're starting to undo that a bit, or it's only a little bit, is it?
I wouldn't have much information on the pay levels, to be honest, about that. I'm sure that is something that the likes of the Psychiatric Nurses Association would be talking about. But I think what we would say is that I know that the recent move has been to recruit people at a lower grade, and what we're saying is that it's very important that the staff that are hired are experienced in mental health and that they have supervision as well. That's really important.
Yeah, and just a couple more questions, Lara.
Yeah.
Is it true, that the mental health services in Dublin are pretty good, overall?
We'd see a fairly mixed picture, to be honest. Obviously there are some great services, there are some that are not so great. So, to try and hear from people what's going on the ground, we hold 4 public meetings a year, so public consultation meetings. One of those is always in Dublin, and we really hear a mixed picture. So I suppose a bit of a postcode lottery in terms of what catchment area people are in. And I wouldn't want to name specific areas or services, but I suppose you would hear that some services are offering multidisciplinary different types of therapies. That maybe there's a day hospital where there are a lot of different activities, there's counselling available and that kind of thing. Others where it's not so great, where it's been described by one of the people who came to our public meeting as coffee and cigarettes, that there wasn't a huge amount on offer. So I suppose a real concern for us is that there's not the same quality of service across the country, that it needs to be good quality no matter where you are. Yeah,
that's true. You're right. And I heard that, is it true that the day hospitals, and could you explain to people who don't know, what are day hospitals? They're not actually hospitals. People don't stay in beds and anything like that.
No, so I suppose after somebody has been in inpatient care, or perhaps if it's decided that they don't need the level of care that comes with inpatient care, they would go to a day hospital, which is, I suppose, a place for people to go, usually just working hours 9 to 5, Monday to Friday, where there'd be a number of activities on offer. So sometimes art therapies, talking therapies, often group therapies, and support from their community mental health teams. But the quality of those varies. So some of them are fantastic and people have a key worker and really good support. Others, I suppose, they're overstretched and they wouldn't have so many therapies on offer.
Yeah, I was talking, I won't say where she's working, but I was talking to an occupational therapist, and she was telling me in her area in Dublin a few years ago they had loads of activities in the day hospital in the morning and in the afternoon, but now they only have a couple a week. Is that common, is it?
Again, it depends on where you go and who you talk to. But I think it is quite a mixed story. Like one of the things we've been calling for is actually 7-day-a-week day hospital, because obviously people's need for support doesn't end on a Friday at 5 p.m. So that's one thing that we're very strong on, is that there needs to be 7-day-a-week support for people. And I suppose crucially there needs to be 7-day-a-week crisis support for people as well. So people are feeling suicidal or in distress. It's not good enough that their only option is to go to A&E, but they need to have other types of support 24 hours a day.
Yeah, I was going to ask you about that. That really would be brilliant. Instead of having a 9 to 5 service Monday to Friday, and then people, if they're feeling unwell or suicidal, they have to go down to casualty and queue for hours. If there was a number, say a mental health nurse or someone they could ring after outside office hours, that would be brilliant, wouldn't it? It
would be absolutely brilliant. The Vision for Change, the mental health policy, calls for crisis houses as well, for people to have somewhere for respite. But yeah, I mean, the idea of being able to contact somebody for mental health support 24 hours a day, it is being done in some parts of the country. So some mental health teams have actually made arrangements where there is a phone number that people can contact 24 hours a day, or there's an arrangement with the local inpatient unit where people can phone in for support to speak to somebody, to make an appointment for first thing the next morning if they can wait. So yeah, absolutely, it's really important. And mental health crises don't happen during office hours generally.
I have 2 other questions unless you have more to say on top of that. Just to talk about housing for a minute or two, or a couple minutes. You advocate for that as well. People with mental health, chronic mental health difficulties or illnesses, to have adequate access to housing, don't you?
We do. One of the things we're asking for in our pre-budget submission to government actually is about designated housing for people with mental health difficulties. So I suppose there's 2 strands to this. One is actually providing the housing for people, and we know that there are, I think, about 600 people who'd be ready to move from HSE supported accommodation into independent living with the right support. So the houses themselves are one part of it, but then the other part is I suppose what would be called tenancy sustainment support. So really just that support that's there to help people to manage, whether it's paying the bills, paying the rent, dealing with neighbours. So that's kind of social support really. Some of Mental Health Reform's members are providing that. So the likes of Hale Housing and Peter McVerry Trust are doing brilliant work to help people stay on in their rented accommodation, in their flats. It's so important for people to get back into their local community.
Yeah, and where are these 600 people living now? In hospitals?
They would be in HSE supported accommodation, so I suppose what would have been called congregated settings, so group housing, some of them with high support, but there are people in medium support who would be able to move out.
And is it true that 25% of people in the world have a mental health illness?
I suppose mental health reform tends not to look at it as an illness, so maybe that's an important one to explain first of all. People prefer to talk about, and a lot of our members prefer to talk about emotional distress or mental health difficulties. Some people don't necessarily see their experience as an illness, and certainly we would advocate that people can recover from mental health difficulties. So I suppose at the outset that's kind of important to say. The figure that we use to describe it is actually that 1 in 7 people in Ireland will have experienced a mental health difficulty in the last year. So I think that shows kind of how immediate it can be, And I think, the international figure is 1 in 4 over their lifetime will experience some kind of mental health difficulty. But I suppose, none of us are immune to it, and it can touch any family. I suppose that's the reason why if I could say a word about the campaign that we're running at the moment, we're encouraging people all across the country to let the government know that they care about mental health. So we have a petition online. It's called Invest in My Mental Health, and if people want to go to our website, it's mentalhealthreform.ie. They'll find a petition to government there, and is asking for funding for mental health services in the community, for housing, for mental health promotion as well for children and adolescents. So just encourage people to really get behind that and put as much pressure as they can on the government between now and budget day. And
the children's service is supposed to be very bad reports about a lot of those services, isn't it?
There are some great services out there, but they're really overstretched because they're staffed at about half of what they should have. It means that there are waiting lists. We also have the issue of children still being admitted to adult inpatient units. So that's something that both ourselves and the Mental Health Commission have raised concerns about that this is still happening. So, you know, we need, I suppose, the range of services for children that we need go right from mental health promotion and how they can look after their own mental health in schools, all the way through to, you know, early intervention if somebody needs support, that it's really clear where teachers or parents need to get that support from. And then if people do need specialist support, that the children and adolescent mental health service teams are built up to what they should be.
Yeah, just last question. I don't know if you have a policy on it, but do you know the way, like, talking about day hospitals and even probably hospitals themselves, psychiatric mental health hospitals, like, would you be in favour of more complementary therapies being available? Like, I know in some places yoga, I think, is available and do meditation, but like other therapies as well, like Reiki. Like I used to do Reiki. I love Reiki. There are loads of different there are loads of different complementary therapies, and personally speaking, I only have an interest in a small number of them. I don't want you to think I'm a big massive advocate of them in general, but would you be in favour of more of them being available? Like?
I suppose, again, like, mental health reform doesn't have a policy on that as such in terms of complementary therapies, but I suppose what's important is that people are given choice. So yeah, you know, the people are given a choice of therapies, that it's not a medication first approach or a medication only approach. So whether that is talking therapies, you know, bibliotherapy, so books that might help people, exercise, and I suppose that it's person centred, so that the person is at the centre of what therapies they want. So whether that is something like yoga, or, you know, we see a lot of people doing the RAP courses, Wellness Recovery Action Plan, so that people are I suppose doing a course to try and figure out what works for them. And, you know, everybody's different, and different things will work for different people depending on what their mental health difficulty is. So it's really important that services work with the person to find out what's best for them. Yeah,
I just say, speaking piracy just for briefly a minute, like, I had two kind of big crises in my life. One was when I was in about 19 and I stopped. I used to smoke hash, not all the time, but cannabis, like, and then I did ecstasy for about a year on the weekends, and then I had to feel when the after effects of that all caught up with me when I was about 19. I went through like hell for a year. And then it happened to me a few years ago, coming off drink. I haven't drank in nearly 5 years, but a few years ago when I drank heavily, only for a couple of years, but I still binged for a couple of years. And like the biggest things to help me were Reiki, counselling, and up there with the three of them. I don't think a lot of people appreciate this, but as you were saying, bibliography, I forget the term
bibliotherapy,
like reading
book
books.
Therapy, yeah.
Like the amount of books I have at home, particularly on spirituality, and I even though I've read them all, I still regularly reread parts of them, and there's so much information in them that like when I reread parts, so I'm always learning stuff that I've forgotten about. It's amazing, isn't it? Yeah,
absolutely. I think there's so many different things that can help people, you know. Maybe like one other important thing to mention while I have the chance is peer support. So, you know, that people who have been through their own experience of mental health difficulties and come out the other side support those people who are in the middle of it, who are going through mental health difficulty now. So there are some brilliant peer support projects out there. Like, to name just one, there's the Gateway Mental Health Association in Rathmines, who do fantastic work supporting people. All the people who are working there would describe themselves as people with self-experience, so their own experience in the past of mental health difficulties, and supporting those who are going through it now. So I think that's a brilliant model, because it really shows you that recovery is possible, you know, that someone who's right in the middle of it is being supported by someone who's come out the other side, and that there's light there at the end of the tunnel. So I think that's a really important message about recovery that needs to get out there.
Yeah, okay, Lara, is there anything else you want to say before you go? And if there isn't, if you could just give us the contact details of Mental Health Reform, and maybe name a couple of other organisations that people want to find out more about mental health services.
Yeah, absolutely. No, I suppose just to kind of reiterate that we really, really appreciate people's support. Budget Day is on the 13th of October, so it's about 6 weeks away now. So just to get people signing the petition, sharing the link on Facebook and Twitter would be fantastic. So that's mentalhealthreform.ie. But yeah, for anybody else who's looking for information on mental health, or indeed for anybody who might be listening to this and maybe feeling that they need some support, I'd like to maybe give out the Samaritans number. So they have a new free phone number. It's 24 hours a day, 7 days a week, and it's 116 123. That's 116 123. So just those 6 digits, free phone, even from a mobile, and it's 24/7. The other website that might be useful to people is yourmentalhealth.ie. So it's a new website from the HSE, and it's got a directory of mental health services and supports all across the country, and it also has some useful tips on kind of looking after yourself and your mental health as well.
Okay, Lara, it's great talking to you. I'll talk to you again. Hopefully, I might talk to you. Hopefully, just after the budget. Hopefully, there'll be good news.
Yeah, hopefully, and thanks very much for having us on.
Okay, thanks, Lara.
Thank you.